speakers will be Fu-lun Li and Bin Lin from Shanghai University of Traditional Chinese Medicine, and they'll be speaking about alternative therapies for chronic and refractory skin ulcers.
Hello everyone, good noon. My name is Fu-lun Li, come from Shanghai University of Traditional Chinese Medicine, and the topic of my presentation is alternative therapies for chronic and refractory skin ulcer, the clinical management and experimental for traditional Chinese medicine. Because I'm very interested in the wound healing treated with by the Chinese medicine, so I give some the method of how the Chinese people treat the wound by our own way, and show some typical clinical patients that we treated, and doing some animals to show how this Chinese herbs works. So the first we have to know the definition of chronic skin ulcer. A chronic skin ulcer, CSU, is defined as a wound lesion that lasts more than 4 weeks without remarkable healing tendency, or as a frequent recurrent wound. CSU is a large burden on the healthcare resources. As we know, there are more than 8 million patients who have been diagnosed with CSU each year in the United States, and those patients cost more than $10 billion each year. However, in China, we have the largest chronic skin patients, with accounting for 1.5 to 3% of total hospitalized patients in the surgical department. And these patients is very interesting. The more advances of the society, the more CSU patient we have. And the most common causes of chronic skin ulcer occur in the venous hypertension ulcers and the diabetic ulcers, and arthritis insufficiency ulcers, and the process ulcers. There are still other rare causes, including the tuberculosis infection, or square cell, SCC, and other diseases like the gout also can causes the chronic skin ulcer. The venous hypertension ulcer is known as a venous stasis ulcer due to chronic venous insufficiency and distal vein hypertension. Most common causes of happen on the leg ulcers, usually due to post-thrombotic syndrome. It affects 1 to 2% of adult population. About the diabetic ulcer, diabetic foot lesions are responsible for more hospitalizations in China than any other applications of diabetics. Diabetes is the leading cause of non-traumatic lower extremity amputation in the world, with approximately 5% of diabetics develop foot ulcer each year and 1% requiring amputation. And third is press ulcer. It has been estimated about 1 million press ulcer occur in the United States. However, in China, reported incidence of press ulcer in hospitalized patients range from 3% to 14%. So how the Chinese people treat this chronic skin ulcer? We treat it as ulcers based on the traditional Chinese medicine. First, we need to understand how the theoretical understanding of CSU developments. In China, the pathogenesis of CSU is theoretically caused by heat evil, which is first described in our old patient book, Lin Shu, Yongju. And in this paper, it gives us the theory and describe about the fresh tissue will not grow until the removal of the nuclear tissues. And the removed nucleus tissue to stimulate the growth of new skin has been demonstrated to be successful in the treatment of CSU for many years in the clinic. And we people also believe that Yu and Xu are the crucial of the treatment of CSU. In the clinical practice, we found that treatment of TCM, according to the principle of removal nucleus tissue to stimulate growth of new skin, has variable outcomes in patients CSU. Although they have ulcers with similar shape, color, secret fruit, and location, similar treatment result in rapid recovery of ulcer in some patients, but not in other patients. Although we always move the damaged and nuclear tissue as much as possible, we do not observe the regeneration of fresh tissue, even with resources for tissue damage in some patients. So the clearance of U should be of the primary strategy for treatment of these diseases. We consider that the skin ulcer is a heat syndrome because of the skin ulcer usually beginning with redness and swelling around the wound, which are progressively form palms. In contrast, CSU is always at the middle or later stage of diseases, persists with the characteristics of 1, the dim, dark skin around the wound, subsident wound. The 3rd, a little pus and secret, and 4, gray and pale granulation. All these characteristics belong to the syndrome of Yu, means deficiency, and Xu deficiency and Yu stasis. However, therefore, clearance of full removal of nuclear tissue is just one way to restart the diseases. We believe that the removal of stasis is crucial for the treatment of CSU. We further emphasize the view that removal of stasis is beneficial for the growth of new tissue with the little scar. So the first we must do is to give the characteristics of different syndrome of ulcers in TCM. The syndrome is a complex disharmony pattern of signs and symptoms at a given stage of the development and progresses of disease, and it reflects the internal and external condition of the individuals as well as the pathogenesis, location, instincts, healthy energy, and evil struggle, and the degree of the diseases. The syndromes of CSU are the comprehensive manifestation of systematic and local pathogenesis. The first of our CSU qing-hua-bu protocol, the first at the clearance of heat and the promotion of diuresis to treat dampness invasion at early stage of CSU. At the early stage of CSU, foreign particles and bacteria in the wound area will be cleared by the activated infiltration neutrophils and by macrophages. A case with dampness heat diffusion downward syndromes of CSU manifested with fresh red meat accompanied by odor pus, thick or thin ulcer edge, red or dark skin around the ulcer, as well as heat beginning the pain. Sometimes patients with the ulcer may have a red tongue with a thin or a thick yellow coating and a sleepy and struggle pulse. And second, promoting blood circulation to stimulate blood stasis of the treatment of patients with CSU and qi stagnancy and blood stasis syndrome at the middle stage of the wound healing process. In these patients, the wound usually displays dark redness and dim purples around the granulation tissue with a hard base. Patients usually have stasis pores and ecchymosis on the dark red tongue with thick white greasy or yellow greasy. And their pulse becomes struggle and slow and obscure. At the later stage, supplements of deficiency to promote granulation for the patients, to the treatment of patients with CSU and vital qi deficiency and blood stasis syndrome at a later stage of the wound healing process. At this stage, patients with a vital qi deficiency and blood stasis syndrome usually display a subside wound with pale or swelling granulation, but without observed nucleus tissue. Their tongues are pale and fatty, with teeth marks around the brim and ecchymosis, as well as thin and white greasy, and their parts are struggle fine or heavy fine. As I introduced the strategy for our way to treat these patients, so it is useful. We designed the external application of Chinese medicine on diabetic ulcer. As shown, this experiment is carried out by the open, random, and clinical trial. Totally, there are 78 patients are observed, but only 62 patients enrolled in this study, and half of them enroll in the traditional Chinese medicine therapy, and another half is enrolled in the Western medicine therapy. So as the results show, all these patients included in this study have diabetic ulcers for more than 1 month, with the longest course of 2 years. 9 patients out of 29, 33% have wounds healing completely within 4 weeks in the TCM groups, and there was no significant difference compared with the Western medicine group. However, the efficacy rate in the Chinese medicine groups was significantly higher than that in Western medicine. The mean wound healing time is 22.71 days in the CM groups, and 26 days in the Western medicine group. The healing tendency of the ulcers that were estimated by 75% in the 2 groups. As we observed that the external Chinese herbs is downregulated WNT signal expression. In the normal non-healing skin, the beta-catenin expression is located in the membrane. However, when a wound is formed, the beta-catenin protein is expressed in the nucleus. With the ulcer syndrome changed to better, with treated, the pattern is changed. The beta-catenin expression from the nucleus changed to normal. These are the clinical patients that we treated. This man is 82 years old man, suffer from venous hypertension also for 1 year. It's before and after the treatment. This is before and after the treatment. So this 8 years old woman scared herself in a hot heater, and we treat these patients before and after treatment about half a year. And this is another patient before and after treatment. This 48-year-old man suffered from pyoderma gangrenosum for about 3 months, the before and half a year. This patient is transferred to our department by the Western Medicine and University, and he is 62 years old man, suffer from pyoderma gangrenosum for about 1 year, and we keep the chromosome for maintaining chromosome and using the Chinese medicine. The wound is healing. And this is 55-year-old man, suffer from diabetic ulcer about 3 months is before and after treatment. So how these patients, the information looks like, we're doing some HE staining to check these wounds. We found that the inflammation markers are all upregulated, about CD45, TGF-beta1, and phosphoSMAD2, and NF-kappa B. We designed another animal study to observe the effects of the Chinese herbs on the inflammation associated with wound healing. And animals is about C57BL6, 8 and 10 weeks older, and the treatment used the Chinese herbs, means SGHY ointment, Chinese herbs. In this protocol, the mice punched at the day 0 and applied the ointment every day, and taking a picture at every other day. We take the tissue at day 3 and day 7 and day 12 and 20. The quality control was determined by the HPLC also. After using external Chinese herbs ointment, we found it can promote the wound healing. As we can see from this picture, that the positive control of the PDGF is much faster than the other two groups. However, the Chinese herb ointment also can promote wound healing. It is and the healing curve is in the middle. It's not good than the PDGF. However, as we know, the PDGF is the only one medicine that promoted by the American Food and Administration, Drug Food Administration, and it's pretty high. And the price is pretty high, about $650 per tube. Our Chinese ointment is much cheaper than it. The inflammation marker about CD45, phosphosphometal, and alpha-kappa-B also down-regulated after the treatment. And the BRDU, which is indicated the cell proliferation, is upregulated. So our summary is that chronic skin ulcer is associated with evil, stasis, and deficiency based on traditional Chinese medicine syndrome differentiation, and strategies for syndrome systematic treatment of patients with CSU by the qing-hua-bu protocol is a very useful protocol. A Chinese alternative therapy is effective method for chronic wound treatment, which is maybe through the anti-inflammation and promote the proliferation. At last, I'd like to introduce our department. The team of Dermatology, Yueyang Hospital, affiliated to Shanghai University of Design Medicine. The man in the middle is our director. This is our group. I'd like to thank Wenchen Jiang, he's the PhD, and the Ma Tian PhD. These two guys helped me to do some animal experiment. And the Xin Li and Qing Xiao is the MD, helped me to do some observation of the clinical patients. Thank you for listening.
Open for discussion now. Any suggestions or concerns? With this, you mentioned wind signaling is down-regulated.
I'm sorry?
Wind pathway is down-regulated.
It's
right?
down-regulated. Yeah.
With the treatment, the herbal treatment.
Good point.
With the herbal treatment, with your treatment,
Yeah.
herbal extract or whatever, the wind signaling pathway is
Yeah,
down-regulated.
it's down-regulated.
Down-regulated.
Yeah.
So, in continuation with that, did you see any evidence that it is not affecting the bone?
Sorry?
Do you have any evidence or any published data that it's not affecting the bone? Because for the maintenance of bone architecture, wind signaling pathway is very important.
Yeah.
So, is there any way?
You mean
there any
the other
evidence?
evidence about the
That it
signaling?
is not, this herbal extract is not affecting the bone homeostasis.
Oh, yeah. The wind signaling is there's some controversial in the wound healing. Some of the group reported that in this CSU ulcer is upregulated. Some of them is low regulated. However, this research is observed in different stage or different component of the ulcer. Some of the epidermis, some of the fibroblast. So that is different. Our group observed that if the wind signaling is overexpression in the fibroblast, that would be the good things for the wound healing. But it's overexpression in the keratinocytes. It's not good. So, yeah.
Thank you. An opportunity to hand over the certificate of recognition to Dr. Lee. Thank you.